All right, I think it's safe to go ahead and get started with our presentation for today. I want to welcome everybody to some informative information on the new employer reporting requirements, a new requirement under the Affordable Care Act healthcare reform law. Before we get started, just want to go over a couple of quick logistical items. This webinar has been pre-approved for one general HRCI recertification credit. In order to receive the credit, we need you to remain on the call for the duration. If you qualify for the credit, we will send you a certificate of completion through email within 2 to 3 business days, so probably get that early next week. In addition, in order to eliminate any background noise, we have put all phone lines on mute, and we will not be opening them at all throughout the webinar. If you do have any questions, we encourage you to use the chat function, and at the end of the presentation, I'll do my best to answer as many of those questions as I am able. I want to formally introduce myself. My name is David Lindgren. I will be the moderator of today's webinar. I have worked for our organization, Flexible Benefit Service Corporation, for the past 11 years, and I now serve as our compliance officer. And a large part of what I do is to try to help our organization sort out all the new requirements and disseminate that information down to employers as it relates to the Affordable Care Act. I want to give you a few pieces of information about our organization. I know some of you, if not many of you, are first-timers on our presentations today. Our name is Flexible Benefit Service Corporation, as I previously indicated. We like to go by FLEX for short. We're located in Rosemont, Illinois, which is just outside of the city of Chicago, right next to O'Hare Airport. We have approximately 100 employees. We were founded in 1988. Last year, we celebrated our 25th year in business. And we have 3 primary business divisions. We are a general agency, a benefits administrator, and more recently have launched our own private insurance exchange. To elaborate a little bit further on our business divisions, as a general agency, we wholesale insurance products. So we are not selling insurance directly to employers or employees, but rather working through insurance brokers, consultants, and other financial professionals to help them deliver competitive insurance products to their employer clients. Some of our key relationships are listed on the screen here. This would be some of the insurance companies whose products in which we wholesale. Aetna, Blue Cross, United Healthcare, Principal, Delta Dental, as well as some others that you see. In addition, we are a third-party benefits administrator. According to Business Insurance Magazine, we are the 9th largest third-party benefits administrator in the country. While we'd love to be a little bit further on that list, quite frankly, we're happy at number 9. When we take a look at all the other companies that are on the top 10 list, almost all of them are Fortune 1000 companies. So we're very happy that we have a strong footprint in the marketplace, being much smaller in terms of our employee population size. As a third-party administrator, we do assist employers in the administration of cafeteria plans, of flexible spending accounts, including dependent care flexible spending accounts. We have health reimbursement arrangements available to active employees as well as retirees. We have our own proprietary health savings account. We administer COBRA, do non-discrimination testing, as well as some other items as you see. Lastly, our private insurance exchange is our newest product offering and business division. We refer to our private insurance exchange as InsureX Solutions, and this is really a way for employers to get a more simplified employee benefit platform. Really employers that are looking to use a fixed cost or a defined contribution approach to streamline the benefits buying experience for employees and minimize any administration as much as possible on the employer side. From an employee's perspective, we really try to personalize that insurance enrollment experience by offering them an online insurance marketplace with multiple coverage options from multiple companies, different decision support tools, along with being backed up by an integrated call center. So I want to thank you for listening to an overview of who we are and who I am. And now we'll get into the core of our presentation, for the remainder of the duration that we have here. I'll do my best to get through the presentation on time to get everybody out by 12 noon Central, 1 Eastern. If you do have questions, again, please use that chat function on the bottom right-hand side of the screen. But want to sort of set the stage first as to why there are some new employer reporting requirements, and then get into some of the specifics about what's needed in the reporting and when that reporting has to be filed. So when we take a look at the employer reporting requirements, they are a new requirement as per the Affordable Care Act, also known as the Health Care Reform Law. And two of the more significant changes in the Health Care Reform Law are, one, eligible persons or eligible individuals can now access subsidized health insurance plans in the individual marketplace, or also known as the exchange. So depending on certain criteria, a person may be able to purchase a personal insurance plan or an individual insurance plan and receive some assistance through government subsidies to reduce their premiums and or reduce their out-of-pocket exposure. Then, in addition, another significant change as part of the Affordable Care Act is that certain employers may be subject to penalties if they fail to provide health insurance coverage to their full-time employee population that is considered affordable and provides minimum value, which I'll define those terms here shortly. But to elaborate a little bit on that first major change, the subsidies, an eligible person would be defined as somebody who has household earnings of up to 400% of the federal poverty level. Just to give you an idea, a single household person that was earning around $46,000 or less per year would be within that 400% of federal poverty level. If we're talking about a family, using a family of four as an example, a family of four earning with household income of around $95,000 or less per year would be within that 400% threshold. Now, in addition to income criteria, an eligible person would be somebody, or an ineligible person would be somebody that has access to other government programs, such as Medicare or Medicaid. Now, from an employer perspective, to keep a person eligible for subsidies, they have to be in a situation where employer-sponsored coverage is either A, not offered, B, not affordable, or C, does not provide minimum value. So just sort of keep that in mind when we're talking about subsidy eligibility. Now there's two different types of subsidies I alluded to already. One is referred to as the advanced premium tax credit, and this helps individuals reduce their insurance premiums. And the other is the cost-sharing subsidy, and this helps individuals reduce their out-of-pocket exposure. Now, I'm talking about these requirements, the subsidies and the employer mandate, because these are going to be some things that are important as it relates to the employer reporting. So I want to talk for a moment about the employer mandate, because there's been some significant changes that have occurred. When we take a look at the IRS code, we're looking at code section 4980H. And that's a new part of the IRS code that has been added as part of the Affordable Care Act. And when we talk about the employer mandate, we're really talking about the fact, at least under 4980HA, the first section of that code, the requirement is that employers must offer health insurance coverage to 95% of their full-time employee population, as well as their dependent children up to age 26, or risk a penalty payment. And that penalty payment, that exposure is $2,000 annualized, multiplied by the total number of full-time employees. However, the employer does get to subtract 30 employees from that. And I'll give you a calculation here shortly as an example. But in addition, there's another IRS code section 4980HB that states even if an employer satisfies the requirements mentioned above, so even if an employer does offer health insurance coverage to 95% of their employees or more, the employer does risk a penalty of $3,000 for those full-time employees in which coverage is not considered affordable and or does not provide minimum value. And again, I'm going to elaborate on both of those here now. So let's break it down a little further. So when we're talking about the employer mandate, the first penalty, we'll call it the offer requirement, the penalty is triggered if the offer requirements are not met and just one full-time employee applies through the new insurance exchange, also known as the marketplace, and receives a premium tax credit. So they receive assistance to help pay for their insurance premiums for an individual plan. So let's use a hypothetical example here. We've got a fake company here that we're using, Employer XYZ, and in this example they have 500 employees and they do not meet the offer requirements under 4980 HA. So they are not offering health insurance coverage to 95% of their full-time population. So they're either not offering coverage at all or offering to less than 95% of their full-time employees. In that situation, if just one of those full-time employees applies through the exchange and receives a premium tax credit, that employer is looking at a $940,000 penalty. We're going to take those 500 full-time employees. The law allows for a waiver of the penalty on 30 of those employees. And then on an annualized basis, we're talking about a $2,000 penalty. That's $940,000 in total. So breaking it down a little further, let's talk about the second penalty, 4980 HB. So you're going to look at this penalty when an employer does satisfy the offer requirement. So they're offering coverage to at least 95% of full-time employees, but they're not offering to 100% of full-time employees. Potentially not offering, or if they are not offering, or if they are offering, coverage is unaffordable or does not provide minimum value. So the penalty here is triggered and applies to just the full-time employees that receive a premium tax credit through the exchange. So we've got a hypothetical example here. Let's continue using Employer XYZ. Remember, they have 500 full-time employees. And let's say they do offer health insurance coverage to all 500 of those full-time employees. But to a small segment, 50 of those employees, those 50 will generally be the lower waged employee population class. To 50 of those employees, coverage was not affordable. And all 50 of those employees decide to waive the employer coverage, and they end up applying through the insurance exchange and receiving a premium tax credit. Well, in that scenario, the employer is looking at a potential penalty of $150,000. That's a $3,000 annualized penalty times those 50 employees that accessed a premium tax credit, giving us the $150,000 penalty. So I want to define some terms before we get into the employer reporting section of the presentation. When we're talking about affordable coverage, what is affordable, at least in terms of the healthcare reform law? And I find it easiest to illustrate this with a couple examples. But when we talk about the Affordable Care Act and the term affordable health insurance coverage, this is a scenario where the employee has to pay no more than 9.5% of their wages for self-only coverage for the lowest cost plan option. And that's quite a mouthful when we take a look at that statement. What does 9.5% of wages for self-only coverage for the lowest cost plan actually mean? So that's where this table comes into play. So I'm going to continue using Employer XYZ as an example. And in this scenario, Employer XYZ offers 3 different health insurance plans to their full-time employees. They have a PPO plan, an HMO plan, and a high deductible health plan. And there's a different rate that the employee has to pay depending on which plan option he or she chooses and whether or not they're covering any other family members or dependents. So you can see there's a self-only rate, and that will vary by the plan option. There's an employee plus spouse rate, which varies by plan option. An employee plus child or employee plus children rate, which varies by plan option. And a family rate. So you've got here 3 different health plans and 12 different rates. But when we're taking a look at whether or not coverage is affordable, we're just going to look at the self-only coverage. So we're just going to look at that. Right here, where the yellow area is, you should see the self-only coverage. And then we're going to look at which of these three plans, the PPO, the HMO, and the HCP, is the lowest price option. And in this scenario, it's the high deductible health plan. It's $125 per month is the rate for any full-time employee that elects coverage. So if you look at the circle that's just next to the chart, it states that if that amount is less than 9.5% of the employee's wages, then coverage is considered affordable under the law. So hopefully that chart eases things up. I know many employers do offer multiple plan options to their employees. Now let's talk a little bit about minimum value and what does that actually mean. Well, in the government's eyes, the term minimum value equates to a health insurance plan that has 60% actuarial value. And what does that really mean? Well, in my terms, or in my definition, trying to use some layman's terms here, it's a health insurance plan that's expected to cover 60% of the average employee's medical claims. So if an employee had a $10,000 hospital bill, on average, that health insurance plan should be covering 60% or about $6,000 or more of that. Now, you may not know whether or not your health insurance coverage that's offered by your employer or the plan that you are facilitating on behalf of your employees has minimum value. The first place I would check is with the insurance company that administers your health plan, and they should be able to help you figure out whether or not your plan has this minimum value requirement. And if not, the IRS has also released a minimum value calculator. It's essentially a Microsoft Excel spreadsheet where it's going to ask you different details about your health plan. It's going to ask you, what's the deductible, what's the coinsurance, are there office visit copays, prescription copays, emergency room copays, and the spreadsheet does an actuarial calculation and provides a percentage, and if that percentage is 60% or greater, then you do have minimum value offered under your coverage. Okay, so just to elaborate a little further on the employer mandate here, so when we talk about the penalties and which employers are subject to the penalties, a lot of the language refers to something as applicable large employers, or ALE for short. That's not illustrated on the screen here, but what an applicable large employer is under the law is an employer that has 50 or more full-time equivalent employees. And if that's the case, then you as an employer are subject to the employer mandate and may be subject to penalties under those two IRS code sections, 4980HA and 4980HB, for noncompliance. Okay? Now, one thing I want to point out is there is some transition relief under the employer mandate that was issued for the year 2015. Originally, the employer mandate was supposed to take effect January 1st, 2014. Then it was supposed to take effect January 1st, 2015, and it still is on schedule as of now, at least, to take effect in 2015. However, there have been some modifications to how the employer mandate is being rolled out. So when we look at the two potential penalties under 4980HA and 4980HB, first transition relief rule that applies next year is that the employer mandate generally applies to employers that have 100 or more full-time equivalent employees. Okay, so for 2015, most employers that have 50 to 99 full-time equivalents are going to be exempt from any penalties as indicated under the employer mandate regulations. Now, under 4980HA, this was the requirement to offer coverage. The regulations state that to satisfy the 4980HA requirements and to not have a penalty payment, if you recall, an employer must offer coverage to at least 95% of full-time employees. Well, under 4980HA in 2015, that offer requirement is reduced to 70%. So as long as the employer is offering coverage to at least 70% of full-time employees, they will not be subject to penalties under 4980HA. The penalty for not meeting the offer requirement is still a $2,000 penalty for each employee, assuming just one receives a premium tax credit through the exchange. But the penalty does not apply to 80 employees in 2015. So if you recall, the regulations state there's a reduction for 30 employees, but in 2015 there's a reduction for 80 employees. So some slightly additional relief there. Now, when we look at 4980HB, there is no additional relief other than the fact that the rule generally applies to employers with 100 or more full-time equivalents next year. So if an employer were to just offer coverage, let's say as an example, to 70%, they satisfy that offer requirement, and they do not offer coverage to the remaining 30% of full-time employees, whichever ones they class out. If any of that 30% of that employee population goes out and gets a subsidy in the insurance exchange to help reduce their premiums, then the employer is going to be subject to that annualized penalty of $3,000 for each and every one of those employees that receives that premium tax credit. So have to keep that in mind. Much of the transition relief has been geared towards 4980HA and not so much to 4980HB. All right, so I talked a lot about the subsidies that are available in the exchange and probably dwelled more so on the employer mandate. But I had to set the stage because those are the two reasons why the employer reporting requirements are coming into existence. So two main purposes. The first purpose is that the reporting requirements help the IRS administer premium tax credits and cost-sharing subsidies in the exchanges. If you recall, if an employer is offering health insurance coverage to their employee, and that coverage is affordable, and that coverage provides minimum value, then that's going to disqualify that employee from gaining a subsidy in the insurance exchange. So the IRS needs some form of a report from the employer that's going to communicate information about who their full-time employees are and whether or not coverage was offered to them and if it was affordable and if it provided minimum value. So it's going to help the IRS facilitate those subsidies and ensure that nobody is gaining access to those subsidies that shouldn't be. And then secondly, the other purpose is that it's going to help the IRS assess the 4980H penalties that are applicable to employers. So we just reviewed those penalties under the employer mandate. Could be $2,000 per employee or $3,000 per employee, depending on what bucket the penalty falls under. But without proper reporting, the IRS would not be able to determine what penalty an employer may or may not be subject to. So that was the reason that I was setting the stage with some updates on the employer mandate and the subsidy. So to just kind of dwell on some information, and these are some stats that I actually gathered from the Society of Human Resource Managers website that I believe they gathered from some government reports that were issued at the federal level about the employer mandate. But when we talk about who's going to be subject to the employer mandate, we're generally talking about who's going to be subject to the employer reporting as well. And when we take a look at the size of employers, 96% of employers are not going to be subject to the reporting, and quite frankly, it's because they have less than 50 employees. So the vast majority, when we look at the total number of businesses in our country, are not going to be subject to the reporting. But I know for many of you that are on this call, you work for a larger employer, or at least one that's large in the eyes of the regulators, and you probably fall into this 4% bucket that are going to be subject to the reporting. And I presume that's one of the reasons that you're on the call today, in addition to trying to earn that certificate for your HRCI recertification. But when we talk about the reporting, it was originally supposed to take effect for the calendar year 2014. It is optional for this year. And when I hear the term optional, it usually means that probably most employers are not going to complete that reporting this year. But it might not be a bad idea to do it just to get the hang of it when it is required. So that's ultimately a decision that you and or other managers within your organization need to determine. But there will be a formal requirement for it to begin for the 2015 plan year. So I want to point that out. It's for the plan year. The reporting doesn't necessarily take effect January 1st, 2015. It takes effect on your first plan year that begins on or after January 1st, 2015. So if your health plan normally renews, let's say, August 1st of every year, then you're going to be subject to the reporting as of August 1st, 2015. Now, the reporting needs to be completed by any employer that has 50 or more full-time equivalents. Now, keep in mind, when we talked about the employer mandate and that transition relief for 2015, there is transition relief as it relates to the mandate and the penalties for employers that have 50 to 99 full-time equivalents. But there is not transition relief for the reporting for those employers that have 50 to 99 full-time equivalents. So while no penalties may be applicable for employers in that size demographic, the reporting is still going to be an obligation. So you have transition relief from the penalties, but you do not have transition relief from the reporting. And then I want to point out that there's two different sections to the report. We're going to talk about those sections here momentarily. But some parts of those, or at least one of the two parts of the report has to be completed by the insurance company for an employer that offers a fully insured health plan to their employees. Now, most larger employers do not offer fully insured plans. They offer what's called a self-funded plan or a self-insured plan. So for most larger employers, when we're talking about employers that have, maybe a couple hundred employees or more, in all likelihood, your plan is self-funded. If you're uncertain, check with those that are in charge of your benefits administration and or the insurance company that administers your product or your health plan, and they'd be able to tell you if your plan was self-funded or not. But for many of you on the call, both sections are going to need to be completed at the employer level because you have a self-funded plan. Now, let's talk about the two different reports. The first is under a new part of the Internal Revenue Code referred to as Section 6055 or 6055. And this is actually going to be the bottom section of the report. So if you're looking at a report and it's a one-page report, this is going to be the bottom half of that report. When we talk about what information is going to be required, it's going to require information about the entity that's providing coverage, including contact information. So the entity that's providing coverage is generally going to be the insurance company information. So if you offer coverage that's administered by a Blue Cross or United Healthcare or Aetna or Humana, generally it's going to be their information and their contact information that's going on that form. And then in general, Section 6055 reporting is going to require information about the individuals that are enrolled in the coverage with identifying information and the months in which they were covered. So just to kind of break that down a little bit further, as we're talking about the 6055 reporting and some of the specific details, there's really three specific items that we're looking for in this part of the report, or not that we're looking for, that the regulators are looking for. So we're looking for the name, the address, and the employer identification number or the tax ID number of the plan sponsor. Okay, so that'll need to be one piece of information on the report. Then we're going to need to look at the name and the tax ID number of the primary insured. So for many employees, the tax ID number will be their Social Security number. So we're going to have to include that of the primary insured. And then we're going to need to include the months during the year that the individual was enrolled in coverage under the group health plan or the employer-sponsored plan. So those are the three pieces of information that we're looking for. So, if this is not information that is easily reportable or obtainable today, based on how you document information about your health plan and about your employees, it's things that you'll start to need to consider. So the 6055 reporting, on the surface seems to be, relatively, simple information to understand. Let's talk about, and I should say one other thing about the 6055 reporting. I skipped it before and I've jumped back a slide. The 6055 reporting, if you take a look at the bottom of the screen here, this is the part of the report that is completed by the insurance company for a fully insured plan. So if you do offer a fully insured plan, you don't have to worry about this when it comes time to reporting. But if you offer a self-funded plan, you're going to have to do this as well. So apologize, I skipped that. So let's talk about the 6056 reporting, and this would be, again, if we're looking at the report and it was on one sheet of paper, this is going to be the top section of the report. And this is going to be the information that is always going to need to be completed by the employer, regardless of whether or not you as an employer offer a fully insured plan or a self-insured plan. So when we take a look at Internal Revenue Code Section 6056, just in general, what we're looking at is information about the employer that's offering coverage. So, general details, contact information, etc. I'll give you some specifics here shortly. But you're also going to need to include information about the number of full-time employees that you have, because that ultimately can have some impact on any potential penalties. And then for every full-time employee, there's going to need to be some information included about the health insurance coverage that is available or that's offered, if any at all, and which coverage is offered to the employee by month. So every single month you're going to have to provide details about what coverage was offered. And in particular, you're going to have to include some details about the lowest cost plan that's available to employees for self-only coverage. So I talked about that before when we dissected the definition of affordability. So 6056 reporting has a lot more details that are needed. And again, this needs to be completed by any employer that has 50 or more full-time equivalents, regardless of whether or not you offer health insurance coverage and regardless of whether or not it's self-funded or fully insured. So to start off, we need to include on this report the employer's name, the employer's address, and the employer's identification number, which will be their tax ID number. Simple there. Then we need to include a name and phone number of a contact person, probably somebody in HR or somebody that would otherwise be in a management position in the event the IRS needs to communicate back and forth with you, or in the event that they need to assess a penalty and provide information to you about what that penalty may be. Then there needs to be a certification or an attestation from the employer as to whether or not the employer offered full-time employees, that's what FT employees is, whether or not those full-time employees were offered the opportunity to enroll in minimum essential coverage. You'll sometimes see that written as MEC, and that stands for minimum essential coverage. Then, in addition to that, you're going to have to report the number of full-time employees during every calendar month. So it's not an average for purposes of the reporting. This is going to be something that you need to report for every single month. And for most employers, that number is going to fluctuate. You're going to hire new employees. You're going to have some employees that resign or are terminated for other reasons. And that number is just going to go up and down, and that fluctuation will vary depending on your unique situation and the size. But It's not an average. It's not a snapshot approach. It is, the actual number for every single month. Then we're going to have to, at the reporting level, the employer is going to have to report the months during the year that minimum essential coverage was available for each full-time employee. So you're going to have some full-time employees where coverage may not be available. You might not offer coverage to them, but you may not offer coverage to them for other reasons, such as they're in a waiting period. You can have up to a 90-day waiting period for a new hire before that health coverage would need to be offered to them. So just because a full-time employee was not offered coverage does not necessarily mean a penalty will be triggered on that employee if they are in a situation such as an allowable waiting period. But the fact of the matter is you're going to have to report every full-time employee, regardless of whether or not they just started or not, and there's going to be some reporting code for you to identify if you didn't offer coverage to them, for example, because they were in a waiting period, which would exempt you from a penalty for that particular employee. All right, so then we got to talk, provide some information about cost. So what is the employee's share of the lowest cost plan for self-only coverage that provides minimum value for every single calendar month for those full-time employees? So I think one thing that's been a little tricky is it's not necessarily, you're not reporting cost information on the plan that the employee is actually enrolled in, but you're providing that information on the lowest priced plan that is available to them, again, for self-only coverage. So we're not worried about what the cost is if they're covering spouses or dependents. We're just looking at what is the cost if they enrolled in a single-only plan in the lowest cost option. That's the information that we're looking for on the report. Then we got to provide details about every full-time employee. So you got to have the name of the full-time employee, their address, their tax ID number, which for most is going to be their social security number. And this is going to be information that's needed on that 6056 report. So a lot of information there. So originally the 6055 reporting and the 6056 reporting were two completely separate reports. And there was some concern when the proposed regulations were issued that there were these two different reports, because it looked like, when we were just reviewing some of that information, that there was some duplicate information that would need to be reported, such as details about the full-time employee and their contact information and their social security number and so forth. So when the proposed regulations were issued, there were several comments that were made that there needed to be some streamlined reporting so that it could ease the administrative burden for those that had to complete both sections. And so within the final regulations, they have indicated that there will be a single combined form to complete the reporting. So hopefully, that'll ease some of the administrative burden that exists with completing these reports. So one thing to point out, now there's going to be some simplification processes that are available to certain employers if certain criteria has been met. That's going to, again, ease the burden or the information that has to be reported. And if you are an employer that falls into the bucket of having what's referred to under the regulations as a qualifying offer, it's going to be a lot easier to report information. So we got to figure out, well, what is a qualifying offer? And when we take a look at the definition, a qualifying offer is an offer of minimum value coverage. Again, that's a plan that's going to require at least a 60% actuarial value. So you are offering your employees, at least your full-time employees, a minimum value plan. And when we take a look at the cost of that coverage for the employee-only or the self-only rates, the cost of that coverage does not exceed $1,100 approximately in 2015. And you may be asking, well, how did the regulators come up with $1,100? Well, if you recall, when we take a look at affordability, affordability indicates that the employee has to pay no more than 9.5% of their wages for self-only coverage. And if you take a look at what the federal poverty level is, and you take a look at 9.5% of that federal poverty level, that's going to put you right around $1,100. So 9.5% of the federal poverty level will get you $1,100. Therefore, if you are not charging your employees more than $1,100 on an annualized basis for that lowest cost minimum value plan, you will fall into this bucket of having a qualifying offer, which means you're going to have to file a lot less information when you fill out your report. Now, to talk about the qualifying offer in a little more detail, for employees who receive a qualifying offer for all 12 months of the year, companies are only going to have to report the employee's name, the employee's address, as well as their tax ID number or the Social Security number, and there's going to be some code of some kind or potentially a box to check off that particular employee received a qualifying offer for the entire year. So it alleviates the fact that you're going to have to provide details on a month-by-month basis. It's going to simplify the process, and you're really just going to have to fill out information one time that'll be valid for the entire year. And if there are certain employees who receive a qualifying offer for less than all 12 months, it could be because they're a new hire and they're in a waiting period, or there could be some other reason. But for all of the months in which that employee received a qualifying offers, employers are going to be able to simplify that reporting by just entering a code that a qualifying offer was made for those months. So if an employee had a qualifying offer for 8 months, you'd be able to enter that code, and that would suffice for those 8 months. But then for the balance of those 4 months that they were not that they did not have a qualifying offer, then you would have to do monthly reporting for each of those 4 months, and you would have to potentially specify why coverage was not offered to determine if a penalty was assessable. So some other details here. We're getting close to wrapping things up here. There are some things that were in the original proposed guidelines that were required in the reporting, and after public comment, there are some pieces that are no longer going to be needed to, again, simplify the reporting process and make it a little easier for employers. So originally, employers were going to have to report the length of any waiting period. Again, waiting periods can be up to 90 calendar days. That's no longer going to need to be reported or included in the report itself. No longer needed is the employer's share of the total allowed cost of benefits provided under the plan. In addition, and I never quite understood myself how an employer would potentially obtain this information, but the amount of the advance payments of the premium tax credit and cost-sharing subsidies, or the cost-sharing reductions, was to be included in any employer report. So any employee that went out and got a subsidy, originally the reports were going to require the employer to include that information in the report. Well, that has been eliminated, and that's no longer required. And another thing that hopefully will ease some things out is originally employers were supposed to include the names of all employees. So that would be your part-time employees, your seasonal employees, your offshore employees, potentially temporary or leased employees, and so forth. That's no longer required. Employers only need to include the names of full-time employees going forward, or I should say, when the reporting starts. So, a couple things just to kind of wrap things up and hopefully bring it all together. You may be wondering, okay, so where is this reporting form? And it does not actually exist yet. So there's not a PDF that I have available, or there's not a website or a link that I can direct you to access this form. It's a form that's in development. So the only information that we have so far is details that were included in the proposed and the final regulations. And from there, we're able to sort of identify the details that are needed in that report. So it's expected that at some point, presumably in the near future, the actual forms will be made available. And there's potential that those forms would be available for public comment and potentially could be altered after that. But one thing to point out again is that the due dates themselves are going to apply for the 2015 plan year. But the report is actually not filed in 2016. You're just filing for the 2000 plan year, but doing so in 2016. Now, when you look at the regulations state that if the report is being filed manually, it needs to be done so by the last day in February of the following year. But February 28th, or I should say the last day in February in 2016 falls on a Sunday. So if you're going to file the report manually, your first due date is going to be March 1st, 2016 to submit this report. Now, I would speculate that most of you are probably not going to do a manual file. You're either going to do it electronically or potentially consult with an outside firm that's going to complete it electronically on your behalf. And if you do complete it electronically, you will have until the end of March, so the first report due March 31st, 2016, if you are going to submit it electronically. Now, another thing to point out is that you're going to be, as an employer or an HR benefits administrator, you're going to need to, you're going to be filing information about employees to a government agency. Again, you're going to include their name and their address and their social security number and so forth. So because as an employer you're going to be providing details about the employee to a government agency, the healthcare reform law is going to require employers to provide a disclaimer or a statement or a notification to their employees about the reporting. And so as an employer, you're going to need to do this by January 31st of every year. So the first notification would need to be done by January 31st, 2016, and you would essentially be notifying those employees in which you are reporting information on to the government to help them police the exchange subsidies and the employer mandate. Now, you may be asking, well, what exactly do I need to notify them of? What's going to meet this requirement? We can sort of speculate some of the information that's going to be needed, but there is expected to be some safe harbor notification language that's going to be released. So there's going to be, we'll call it a model template that either the Department of Labor, the Department of Health and Human Services, or the IRS, or maybe collectively the three of them, will provide some standardized language that can be used to meet this requirement. But I think right now you just need to sort of keep it in the back of your mind that before you file the report, you need to notify your employees that you are filing this report and some information about them. So just a few final comments to close things out, and then I'll open it up for questions. If there's anything we can sort of compare this reporting to, it's really something that's being compared to the W-2 reporting process. And I think many of us probably wish this was not something that had to be done. It's a new administrative task, a new requirement that hasn't needed to be done in the past. But it is the law. It is regulated. It is going to be policed. Barring any unforeseen changes to the employer mandate or so forth, any other delays. This is a requirement that's upon us essentially. There are penalties for non-compliance. These penalties, you can find out more details if you took a look at the Internal Revenue Code, Section 6721 and 6722. But if there is a willful neglect, just as an example, there's different penalties that apply for different circumstances. But if there is a willful neglect on behalf of an employer, you just choose not to file the report, you may be subject to a penalty of up to $100 for every single employee, with a fine capped at $1.5 million. So you probably want to file that report so that there are no penalties that are assessed for willful neglect. Now, of course, there can be reports that are filed and there's missing information or inaccurate information, and there are potential penalties that can apply there. I believe the regulations specify that could be up to $50 for each employee, capping that at a maximum penalty of $100,000. But for the 2015 plan year, which is the first plan year where this reporting has to take place, as long as there isn't any willful neglect, looks like the IRS is going to give a break on any penalties for inaccurate or incomplete information. So you catch a break there as long as you are filling out the report. So there is at least some peace of mind that comes with that, because this is a new task. There may be some questions when you file it as to whether or not you did everything right. And at least this first year, as long as you're not willfully neglecting to file it, you shouldn't be subject to any penalties. So at this time, I want to go ahead and open it up for questions. We got about 5 to 7 minutes here to go through some questions. Again, just to remind everybody, we have your phone lines muted. We're going to keep them on mute just due to the volume of people we have. Please use your chat function to type questions, and I'm going to start reading through some of those that have already come in. There is a question, is there any reporting that's required amongst smaller employers? No reporting requirements are needed, at least as it relates to the reporting we discussed today. No reporting requirements are needed for any employers that have fewer than 50 full-time equivalents. So again, that's 96% of employers, based on some of the stats we were able to locate, are not going to be subject to the reporting, just those that have 50 or more full-time equivalents. There's a question, if the employer mandate gets delayed or potentially is repealed, is the reporting going to be delayed? I couldn't tell you for certain, but you got to keep in mind that the reporting itself, there's two purposes: to sort of police the employer mandate, but also to police the exchange subsidies, so that people are not gaining access to subsidies in the exchanges that they shouldn't. So we do know that reporting would still be needed for the exchange purposes. There's potential that some parts of the reporting could be pushed back if the employer mandate was further delayed and or repealed. There's a question, will there be a model template of the form? There will be an actual template of the form, not a model template. That form has yet to be published yet, and I don't know of a specific due date at this point in time that it will be available. But again, keep in mind, although the reporting starts for the 2015 plan year, it's not actually filed till 2016. In March of 2016, so we're still good 18 plus months away from when the first form of reports had to be submitted. There is a question about where is the IRS minimum value calculator. I don't have the link off the top of my head, and it's probably a lengthy one. If you just use an internet search tool like Google or Bing or Yahoo, and just type in IRS minimum value calculator, you'll see one of the first couple items that pops up will be an Excel spreadsheet that will be the calculator that you can access. All right, several other questions coming in here. there is a number of people that have asked if we can get a copy of the presentation. When I will ask our marketing department to distribute a copy of the presentation when they send out the HRCI recertification certificate. So I'll see if I can't get you these slides with that certificate. Yeah, there's another question just to confirm. That this reporting only applies to 50 full-time equivalents or 100 full-time equivalent. It applies to 50 full-time equivalent or more. So while the mandate penalties have some transition relief for those with 50 to 99 full-time equivalents next year, the reporting, there is no delay in that. If you have 50 or more full-time equivalents, the reporting is required to be submitted by March 1st, 2016 if filing manually, March 31st, 2016 if filing electronically. All right. Well, I think, I've just checked one other spot here, I think we've got most of the questions answered here. Apologize if you were not able to take notes as along with the slides, but I will do my best to get you a copy of those slides when we send out the recertification certificate. I want to thank everybody. I think we're going to finish just a minute or two early here. If you do have any questions, you may reach out to us. If you have questions about HRAs and cafeteria plans and so forth, contact the number on the screen for Flex Plans. If you have questions about our general agency, our wholesale insurance operations, contact that number. Any questions about our private exchange, InsureX Solutions, reach out to that number. Feel free to take a look at our website, flexiblebenefit.com, and you may access any of our social media sites, Facebook, LinkedIn, and so forth, to contact with us. It looks like we had some insurance agents on the call with us today, and just one piece of clarification. This was a presentation for HR professionals and employers, so there is no CEU for insurance agents. This was an HR recertification credit course, not a license course for insurance producers. So do apologize if there was any confusion with that. But with that being said, I think most of the questions have been answered. Again, feel free to contact our office if you do have additional questions. Do appreciate your time today. Look forward to having you on one of our upcoming events. Thanks very much, and hopefully we'll talk soon. Take care. Have a great day.